Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
It is very interesting to know that this anterior approach is becoming more interesting and more worldwide. Now we'll move on to the next question. What is the benefits of this anterior approach?
Direct anterior approach is done making the patient lie down on the bed supine straight, whereas other approaches need to keep the patient on the side. Now, keeping the patient supine or straight on the operation table is very, very helpful for the patient's comfort because he is lying down straight on the bed during the surgery. And also it makes the anesthetic experts to administer anesthesia medicines very easily. And also the anesthetist can handle the patient very nicely on a straight supine position rather than on the side position. And also keeping the patient supine straight on the operation table is easy, and hence it saves time. It also saves time in terms of keeping the patient on the side with varieties of the supports needed on the table. And hence, patient positioning is easy. Patient positioning on the operation table is quicker. And also it's easy for the anesthetist to administer anesthetic drugs. And also it's easy for the anesthetic people to maintain the patient if there is any anesthetic intervention is required during the surgery. And then this operation, as I was describing you earlier, is done through a small incision, small cut on the front of the thigh. What it makes is that we are not going to cut any of those muscles, any of those important structures around the hip, rather we go between the muscles. That makes bleeding is less, the operation time because of lesser intervention required becomes quicker. And also, because the patient is lying down supine or straight on the table, assessment of this patient with an X-ray or a fluoroscopy becomes very, very easy. And also, one of the most important aspects of a hip surgery is keeping the leg length equal, because we want to make these patients' leg equal on right and left side. Because if you are operating on one side, we cannot have a patient who have a longer leg or a shorter leg on one side, which becomes very difficult to assess when you are doing an operation in a side position. Whereas in a straight or a supine position, anybody can assess whether the leg is straight or whether the leg is equal or not. And hence, manually measuring the leg length becomes very easy in a supine or a straight position. And also you can imagine to do an X-ray for a patient in a supine straight position is much easier. And hence, on the operation table itself, we know and we have confirmed by doing an X-ray in a proper position that the component position is good and also leg length is equal by doing all this technology, which is easy to do on a supine position rather than keeping the patient on a side position.